Welcome back to Talk of the Town. I'm joined now by Dr. Eric Paulson from the Wisconsin Optometric Association. Dr. Paulson, welcome to the program.
Thank you for having me.
Yeah, good to have you here. So we're going to be learning a lot about the field of optometry today, so I'm excited for this education. Talk to us a little bit about what is a doctor of optometry, and there's several different fields that you can go into, including optometrist, ophthalmologist, and optician. What are the differences between all three?
Sure. Well, an optometrist is your basic eye doctor, and I often use the analogy of your physician and a surgeon to explain the difference between an optometrist and an ophthalmologist. Let me back up. An optician is a person who goes to school to learn how to make lenses for glasses, and they work in optical shops and do that kind of thing. Optometry requires 4 years of undergrad in usually a science major, and then optometry school is 4 more years, so it's 8 years of college. And an ophthalmologist is a person who goes through medical school and then goes on for a couple additional years to learn the surgery of the eye. So your optometrist is the general practitioner of eye care, and an ophthalmologist is the surgeon or the specialty care.
Okay, got it. And so not all three are doctoral?
They are not. Okay. An optician is an optician.
Sure, sure. Got it. Okay, well, very cool. So, and you talked a little bit about the education that is required. Talk to us a little bit more. Like, can you elaborate on what sort of education that you would need for all three of those?
Sure. So an optician probably would go to a technical college to learn the skills required, and they have some testing that they need to pass to be able to do what they do. An optometrist goes through the 4 years of college as well. And to be able to practice, we have to take a national board, and we also have to take a state board. And so every state is a little different. It requires a great knowledge of science topics, human physiology, pharmacology, a lot of science.
Yeah. A heavy science course, or a heavy science degree, I should say.
That's right.
Yeah, yeah, absolutely. So what impact do optometrists have on the overall health of the patients that they work with?
Well, being an optometrist is a great profession because a lot of people are not afraid to go to their eye doctor, but may be a little nervous to go see a general physician. And so because we're trained in human anatomy and physiology and pharmacology, we're very much aware of health conditions that can show up in the eye. So for instance, if you're diabetic or you have high blood pressure, those are things that we can see in the back of a person's eye. And so we have a great impact in general health, and oftentimes we're sort of the gatekeeper that sends a patient on to another physician for other health issues.
Yeah, I've learned actually a little bit about optometry over the past couple of weeks. I've been working with some optometrists, and they one of the things that they've said is that they've actually caught some of these other health issues just from a routine eye exam. I thought that was a really incredible thing.
Absolutely, and you know, I have a patient that was in my chair yesterday who we discovered had a genetic eye disease by talking, you know, doing an eye exam, talking to her about her history and her family, and sure enough, she has the same thing her father does.
Wow. Wow, that's incredible.
And the other thing that's really amazing is I've had patients, one of the things that we do in our office is we check blood pressure.
Sure.
A lot of patients don't ever get their blood pressure taken, and I've sent many patients up to the emergency room because their blood pressure was 200 over 100, which
oh my goodness.
I'm afraid they're going to spontaneously combust in my office.
Right, exactly, yeah, yeah. And nothing to really laugh about there because, I mean,
No.
that's a pretty serious thing. So, you know, a lot of doctors have different, you know, primary care physicians and so forth have different areas of expertise, or they specialize in certain areas. Are there different ways that you can specialize when you become an optometrist? Absolutely,
and one of the things that is available to optometry doctors after they graduate is internship. Sometimes in something like the Veterans Association, they have externships, I should say. And so many optometrists will specialize in things like pediatrics, where they do vision therapy and work with children that have learning problems. Many doctors specialize in contact lenses. So there are very many areas that can be specialized.
Dr. Eric Paulson from the Wisconsin Optometric Association, thank you so much for joining us today.
My pleasure. Thank you.